Thank you very much for coming after lunch. I'm sure you're all full with delicious food. Thank you for your kind invitation. It's so nice to see you again. Thank you. So I'm very happy to be here. I thank all the organizers, Dr. Ben-Aryeh, Dr. Izikovich, Dr. Lev, Dr. Ronan from here for inviting us. And we've been back from a very interesting workshop, and I'm very happy to be here again. So today I'm going to talk with you about culture and context and child maltreatment. And I'd like to talk a little, have a little background about culture, but then I'd like to talk about some work we're doing in Cleveland, in neighborhoods in Cleveland, Ohio, where I live, trying to look at context and differences among neighborhoods. We know that there are international and global differences in child maltreatment and child well-being around the world. We also know that child maltreatment occurs in all cultures, in all societies. So we were talking in the car yesterday, Bong and I, that there hasn't been a study yet that's found no child abuse. Every place finds that it's a problem. One of the things we need to work on a bit more is that we don't have good understanding of the causes of child maltreatment. So we know it occurs. We need to know more about why it occurs, both within and across cultures. So today I'd like to talk some about culture, which there's no way to really escape culture anymore in any society. Globally, people move, there's a lot of immigration, demographics are changing in every country in the world, including my own. We see, and I'll talk a bit more about it, we see disproportionate rates of reports of maltreatment and disparities. And so we're very interested in looking at what the role of culture, context, and in our case, looking at neighborhoods can tell us. So I'd like to start by saying that when we talk about what child abuse is, we need to leave room for the idea that there may be differences in definitions of what child maltreatment is. So the first level is this cultural level, that cultures simply may define child maltreatment differently and may respond to it differently. And we all have ideas about what child maltreatment is, and as Howard Dubowitz pointed out in his session in Neglect, there's a lot of agreement around the world and in the UN Convention on what is good treatment and what is not good treatment for children, but there's still room for some cultural differences in emphasis and in thinking about what maltreatment is. At the individual level, we know that in all societies, there are some people who maltreat their children, who differ from what their culture says is the right way to do things. In all societies, we know that this happens, from the most indulgent and kind to the most punitive. I also include here societal level maltreatment, because we also know, and it gets sometimes confused with cultural level differences, we all know that there are societal conditions that impact children very badly. In the United States, 20 to 25% of our children live below the poverty level. So it's important to think that in addition to cultural differences, there are also societal impacts. So there is a growing international literature. The International Society puts out a World Perspectives book every year. Child Abuse and Neglect is an international journal. There are many journals now. So the international literature is really growing. But as I said, we still have some areas to think more and do more work, particularly on the causes or the etiology. The literature does tell us that maltreatment behaviors are reported virtually everywhere, wherever we look for it. There have been a number of very nice instruments developed that cross cultural boundaries, but there's also a need to develop other ways of looking at child maltreatment within cultures. And so there's a lot to be done. And I'll say again, because I think it's important, we still need to think about what variables, what factors contribute to maltreatment that you can identify both within one culture and then across cultures. If we say something causes maltreatment, we need more data. We need better research on understanding why. So there have been various approaches in the literature. Some of these approaches have done what we call essentializing culture, or basically saying that because a culture is one way, children are more likely to be maltreated, or because it's one way, they're not. And so this is why I have these equal symbols here. But then we're lost in arguments about whether a cultural practice is really maltreatment, and by whose definition, who's deciding. So we need to think about this and do better work on understanding this. We've been talking in anthropology for many years about the idea of unpacking culture. So what aspects, what is it about a cultural context that leads to maltreatment or that can act to prevent maltreatment? And there are a lot of things that go into culture and go into cultural membership. Dr. Yochai Nadan, who's working with me in Cleveland this year but is coming back here to Hebrew University next year, we've been talking a lot about an intersectionality approach, that there are lots of identities and aspects to people within cultures. We've also been working for some years, and Jim Spilsbury, my colleague in Cleveland, and I wrote a paper for one of Howard's many books on maltreatment, thinking about what is culturally competent practice. And so what this diagram just tries to simply show is that on the far side, you're facing left-hand side, we talk about a more ethnocentric approach where we think about what our culture does, and so that must be the best, the right way. And if we do that, we run the chance of misidentifying culture as child maltreatment. On the other side, there's an argument that's much more powerful and compelling to unpack culture, to look at the multiple pathways that cultures have for rearing their children, and to try and think about how these multiple pathways lead to child outcomes and maltreatment. And so what we're striving for is what we call in the middle a sense of cultural competence. And so what cultural competence involves is a set of skills. Sensitivity alone to culture isn't enough. You need to have a set of skills, an understanding of the context in which you're working, a general knowledge about the enormous cross-cultural variation there is in the world and how children are reared. And sometimes today people have talked about what's the most important variable for a child, or what's the most important thing. Probably the most important thing for knowing what's going to happen to a child is the cultural context into which they're born and where they're raised. It'll determine whether what their socioeconomic status might be, what the rearing patterns are. So it's important to have some general knowledge about the cross-cultural record. In addition to that, you need to know something about the community that's being studied and to look for both commonalities and differences. When anthropologists talk among ourselves, sometimes we talk about groups of people that we're studying that they're so different, but they're just like us. And so you need to think, both about what are the commonalities and the diversities in human behavior. So this is a kind of complicated diagram that's, again, Jim Spilsbury and I wrote, and it's in Howard's book. And I'm happy to give anybody a copy rather than taking time going through it in too much detail today. But basically, this argues that when a family presents to you and you're not sure whether it's maltreatment or not, we need to adopt a more culturally competent approach of working our way through this pathway to decide and to try and figure out for the family's best interest. Is something cultural? Is something not cultural? Does the family just need the best care without a cultural component, or do they need a cultural component in their care? So the bottom line that you're always striving and looking for is how best to work with the families that you're working with. And in the second to last row of boxes there, you can see that while we talk about cultural differences, there are lots of kinds of cultural differences, and we need to sort out, what they are. Cultures may differ in their child rearing, in their definitions. Some cultural practices may make harm more likely or not. Culture change is important. Some practices that were perfectly fine in one setting may become dangerous. If you move from a rural area to a city, then children caring for others or sibling caretaking, which is known around the world, may become more dangerous. And finally, people, all of us can misrepresent culture, and so sometimes culture is not accurately presented. So again, I can easily provide you copies of this. What's drawn a lot of attention to culture in various countries is this idea of disproportionality and disparity. So in the United States, these are the definitions. That disproportionality just means a population is represented differently than their representation in the population at large. But disparity involves inequities, and they go together in some sense, and it's important to pay attention to. And it's this fact that in the U.S. and in the United States, we see great disparities in the culture and ethnic groups that are reported. It's not unique to the United States. You find it in many countries where there are a diversity of populations or an immigrant population. And it's also important to keep in mind that culture or ethnicity is not the only source of disproportionality. So poverty plays an enormous role. SES status. We know across many countries that the poor are overrepresented in maltreatment statistics, and as someone pointed out, I forget now in all the good conversations who that was, that we also need to pay good attention to the people who are doing well in very difficult economic circumstances. I think it was Dr. Lutzker. So this is an example from my city where I work in Cleveland, and what this slide is just designed to show you is that if you look at the proportionality with which African Americans and European Americans are reported and have a substantiated report in Cleveland, we get an enormous disparity. If you look at what we call the life table, that is, if they've had any report before 10 years of age, you can see that almost half of the children in our inner city African American populations have had some contact with child welfare. And so we're concerned not just about the children and the families, but the larger community. This is a lot of contact, and we need to know more about what that is and what it means for a community as well as the individuals and families. So much of the attention to context in child maltreatment has been focused on neighborhoods and communities. So those of you who are thinking about your next research project, the young researchers out there, you can think about neighborhoods in the sense that there are physical boundaries. We have census tracts, you have localities. There are ways to draw physical boundaries. And I'll show you in a minute that even though you can draw these boundaries, they may be perceived differently by different people. So what's been useful, and many of us use what's called the ecological model for looking at children and families as nested in larger communities and cultures. For us, we're used to using NBH for neighborhood. That's what it means. So I didn't spell it out. But the interest is in looking at these red arrows between the levels. So what does it mean for a certain kind of child or family to be living in certain kinds of neighborhoods? And this is a lot of what we're looking at in Cleveland. And so what started us off in this particular, being interested in this particular question is the fact that we could identify parts of our city where there were more or less child abuse and neglect reports. And now, 20 years later, we're very happy that we get to, again, look at these same neighborhoods. We've just started a study to go back later and look at neighborhood context. So what this is showing you is that the gray and the blue lines represent the city and the cities in a county. And very similar to what Dr. Finkelhorst showed you this morning, you can see that rates overall are going down. But in the neighborhoods in Cleveland, we see lots of different patterns. So in some neighborhoods, you see a lot of variation over this 20-year period. And what we want to know very badly, is why? Why is it that you get these different rates of changes in child maltreatment? So we're going to be, these are just 3 neighborhoods we picked at random. So we're going to be looking at 3 different ideas or pathways that can affect these changing rates in child maltreatment. Because if we look at the changing rates and we look at these different components of the neighborhood, we hope we'll be able to tell more about why child abuse occurs and what's accounting for the patterns of change. All of us in the room know how difficult change is to measure, but we're going to try. So the first pathway, so several years before now, we wrote a review paper talking about the different pathways to child maltreatment. So these represent the pathways we're looking at. The first pathway has to do with neighborhood conditions. And we know from our past research that there are conditions in neighborhoods that are associated with, that lead to different rates of child maltreatment. There are structural factors, and I'm going to come back and talk to you about some of these in a moment. There are disamenities, bad conditions in neighborhoods that people have to live with. There are many things that can contribute to this pathway leading to maltreatment. We're also going to look at social services, because it may be that over these years, better provision of services of different kinds, be it daycare, home visiting, different programs, may have helped to reduce this. And finally, we're going to be looking at differences in who reports and how they report. And these 3 pathways are represented in a review of the literature that discusses how different pathways may lead to child maltreatment. So I've gone back to this earlier slide. At the very top of this slide, there's one thing about neighborhood research, is that, at least in the States, we never know why someone lives in one neighborhood instead of another. And so it's called the selection effect, and we just have to try and figure it out best we can and live with it. So let me, in the few minutes I have left, talk to you a little bit more about neighborhoods and some of the issues of doing research. So what are the relevant neighborhood units? How do we identify what a neighborhood is? It seems simple sometimes. You take a census tract, you take a locality. But in our research, we asked people to draw us a map of what their neighborhood is. And so this represents 20 people's views of what their neighborhood is. So we have many different boundaries for their neighborhoods. And the little symbols in between represent, you can see a circle for the common area. So despite the fact that these big lines are a census tract, the circle in the middle is what everybody would agree on. So when you're doing your research or your own research, it's just something to keep in mind and to figure out how to accommodate for. With such good statistical techniques now, you could make a unique neighborhood for each person, but then it wouldn't be, it would be an individual variable. So also, Jim Spilsbury, who did his dissertation on neighborhoods and children, this is one example from his whole sample of how a single family defines a neighborhood differently. So the yellow area is how the parent defines the neighborhood. The red is how the child does. They differ in where they think the child can go alone without supervision. The child thinks one thing, the parent thinks another. And so in looking at parent and child neighborhoods and where children can go unsupervised, that little blue part is the only part that is consistent. So neighborhood research is complicated, but it's also very enlightening about what the context is telling you about how children and families live. So I wanted to quickly say something about a trend towards using what used to be called multiple methods, we call mixed methods now, in the best way to understand neighborhood conditions. So we can use administrative data to give us the larger picture, but we're also very committed to using qualitative methods, and we'll be going back to the same 400 houses that we studied before. We assume there will be different people there, but we'll be in the same places in the neighborhood. So let me just show you a couple of examples. If we use the quantitative data and explain differing rates of child maltreatment across neighborhoods, these are the 4 factors that we get. So impoverishment is not just poverty rate, but you can see the different variables that load. Thank you, Mohammed. Something we call childcare burden, how many children there are for parents, how many old people there are, how many single mothers versus families where there are 2 parents. How much neighborhood movement there is or instability, and whether it's contiguous to another high poverty neighborhood. But if you look at how in the qualitative data, neighborhood residents identify why maltreatment has occurred, they agree with the quantitative to a large degree that it's poverty, family structure, it's this whole atmosphere of disruption and disamenities. They also, so these are things they mentioned. We didn't ask them. We just said what causes maltreatment, and then we coded their responses. But if the thing that was striking to us is if you look at the bottom, less than 8% of these 400 people really thought that individual pathology played a big role in maltreatment, but this is where we put so many of our efforts. I also want to go back just one moment and talk about something that we call childcare burden. And when you think about the demographics of a neighborhood, something that both the quantitative and qualitative data together gave us was that there is truth to the idea that you have a lot of single women, single mothers, taking care of young children by their own, on their own, and it causes a certain level of stress. But in our ethnography, in our more qualitative data, we found that at least in our neighborhoods, people were fearful of young children. They were fearful of intervening with other people's children. And so you have a neighborhood where there's a lack of social cohesion and control in being able to manage other people's children. So I'll make our plea again for using multiple methods. So I'm ending right on time, and thank you very much.